people in our program have desperately wanted to be treated for so long, but they just didn't qualify. And there's been a lot of anger and resentment around that. And so now the fact that the criteria have expanded, we now are able to treat those folks, and it's such a huge burden that can lift from people's lives, and to be Hep C free. One of the exceptions to the criteria is that if you're a woman of childbearing age who intends to get pregnant, that you can get treated. And that's a really important thing, because before, if your liver was healthy, you couldn't get treated even if you wanted to have a baby. And for women who are pregnant with Hep C, there is approximately a 5% chance of transmitting it to your infant, especially during the labor process. So that's a lot of weight to carry, and women are, mothers are already under a lot of pressure to be perfect. So, and to not, harm the fetus or the infant. So I think that takes a lot of pressure off people worrying, wanting to get pregnant, but wanting to get treated before they get pregnant. So we've definitely encountered that in our program. From a medical perspective, there's no reason to limit access to treatment. It's purely a financial consideration at this point. Governments are struggling with the very high costs of these medications. So the companies that produce the medications have set a very high price tag on them. And as a result, governments, I think, feel like they have to ration out these medications. But we don't see that so much with other illnesses. So I think it's partly because hepatitis C has been neglected for so long that there's this, there's a hidden Hep C epidemic, I guess you could say. It's an estimated 44% of people in Canada who have Hep C don't know they have it. So that's huge. So that means a lot of people are going to be becoming ill, potentially having cirrhosis, liver failure, liver cancer. It's going to be a huge health burden. So if we're thinking about prevention and making sure that those people don't get to that place, then we really should be treating everyone and making it a lot easier for people to access treatment. But I think the initial cost is a little bit intimidating. But in other jurisdictions, they've done this. So in Australia, they have no such restrictions on treatment. Like, anyone can get treated at any stage of their liver disease, and I'm hopeful that eventually we'll get to that place. We're not there yet. I know in some provinces, like Quebec, for example, they have a staged plan where they want to treat the people who have the most illness first, and then work their way down to people whose livers are doing better. And they have like a multi-year plan to do that. So that's something to look at. But I do hope that eventually we will no longer have to worry about, are you sick enough to get treatment? Because we're still a little bit in that place. There are still some people who are excluded.